plexuses, like the cervical plexus, brachial, lumbar cervical, all these plexuses, the spinal nerve, when it comes out, so you have the ventral ramus and you have the dorsal ramus. So ventral ramus goes to the front, lateral and front anterior. Dorsal ramus goes to the back. Okay, so these plexuses are formed by the ventral ramus. So the spine, the branch that comes out from the spinal cord that goes laterally and anteriorly, okay, of the body. So they form the plexuses. So dorsal, so the greater occipital goes to the back. That's a dorsal ramus. It comes out from the dorsal ramus branch. So therefore, we don't include the greater occipital as a part of the cervical plexus. But it comes off from the same level, C2. Less occipital C2, greater occipital C2, greater auricular C2, C3, transverse cervical C2, C3 again, right? So greater auricular, lesser greater auricular, transverse cervical C2, C3, supraclavicular C3, C4, right? And how about phrenic nerve?
3, 4, 5 keeps the diaphragm.
Keeps the diaphragm alive. 3, 4, 5 keeps the diaphragm alive. Okay, so 3, 4, 5 keeps the diaphragm alive. So we also have 3, 4 supraclavicular, 3, 4, 5 phrenic. So if there's so phrenic also receives the peritoneum of the lower level of the diaphragm. So if there's an irritation there, it goes to that sensory information goes to the levels of 3, 4, 5 at the level where 3 and 4 goes in with it, supraclavicular. So if you have a pain or irritation or other sorts of damage of the peritoneum, so you will sense that pain where? Right, in the shoulder region where the supraclavicular is located. So if you have a pain at one side, you have to remember that might be a referred pain, and that referred pain would come from the phrenic nerve, where the phrenic nerve receives its sensory information, which is the peritoneal layer of the diaphragm. Okay, so that's those three nerves, right? Okay. And how about the the superficial the vessels? Which vessels do we have here?
Superficial temporal artery.
Right. We have the. So we talked about that, right?
Yeah.
Can you get the lollipop? Yeah, lollipop. Let's look at the just very quickly the branches that we see in the temporal fossa, which is superficial looking. So we have in terms of. So okay, so. Okay, so let's look at the superficial let's look at the artery. So which artery do we have?
Superficial temporal artery.
Superficial temporal artery. Okay, so superficial temporal artery. So where does it come from? Superficial temporal artery.
External artery.
Right. So external carotid gives off two terminal branches, right? Superficial temporal and maxillary. Okay. So those are the. Okay. Thank you. So this is the superficial temporal, as you can see. Superficial temporal, all right. So superficial temporal receives or supplies these areas. So we have the. So they have several branches, like frontal branch, temporal, parietal branches, and it supplies this temporal area. Okay. Superficial temporal. So that's the terminal branch of the external carotid artery, and the other branch is what? Maxillary. Good. So who can tell me the other branches of external carotid?
Facial.
So at the front, it gives off superior thyroid first breath. Superior thyroid. So you don't have to deal with that right now. Okay. So let's look at this. Okay. You see this? So this is the common carotid, and. Okay, so this is the internal carotid, and this is the external carotid. External carotid goes up, and it gives superior thyroid. This is the first branch, superior thyroid. And then you have the lingual. No,
facial.
Okay, so this is the lingual here. Okay, This is the lingual here. Lingual, you know, so it goes to the tongue, and this is facial. So we have superior thyroid, lingual, facial. All right, and at the back you have the ascendopharyngeal. You have the occipital and posterior auricular. Okay, so we don't really see it, but so one of them is the occipital branch, and then posterior auricular. So those are the ascendopharyngeal. Those are the three branches that goes to the other side, and then we have three branches that goes to the anterior. Okay, so those are the three branches, and the superficial branch is the superficial temporal is basically this branch here. And basically this is located superficial, just beneath the skin and in superficial fascia. And you can get the superficial temporal pulse just in front of the tragus. Okay, it's the tragus here, just in front of that. If you put your two fingers, you can get the pulse of the superficial temporal artery. So that's that. So how about the so what else do we have here? In the superficial compartment, we have the superficial temporal vein, right? Superficial temporal artery, superficial temporal vein. So superficial temporal vein, how does it drain? Let's look at that. So it goes down at the level of the when it goes inside the parotid gland and unites with the
Maxillary.
It unites with the maxillary vein, right? It unites with the maxillary vein,
And they forms the external jugular.
It forms a retromandibular vein.
Yeah, retromandibular.
Okay, retromandibular vein, right. So you have the retromandibular vein, but where's that located, retromandibular vein?
Beneath the...
Inside the parotid gland. Okay, they unite. So you have the superficial temporal vein and the maxillary vein. They come together, they unite in the parotid gland, they form retromandibular. Now, retromandibular gives off two divisions, the anterior division, posterior division. Now, posterior division of retromandibular unites with posterior auricular. These two, they come together, they form the external jugular, and external jugular basically crosses the sternocleidomastoid, SCM muscle, sternocleidomastoid muscle. Anterior division, the anterior division unites with the facial, forms the common facial, and common facial drains into the internal jugular, right? Okay, so that's that. So basically, ultimately, superficial temporal vein ultimately joins at one hand via the retromandible to the external jugular. With the anterior division, it drains into the internal jugular. So ultimately, they would go to the brachiocephalic and drain into the heart. So that's it. We talked about the artery, we talked about the vein. Okay, we finished that. And so that's it. Last, concerning the temporal fossa, is the bony component. We didn't look at that. So in the bony component, one of the clinically important area is the pterion fissures, where the fissures unite, and this is what. So there's a connection between these bones. Which bones we have? We have the frontal, we have parietal, temporal, and sphenoid. See? And this is H, the letter H. Everybody look at the skull, and show me the pterion. The combination of the suture where you have this the area called pterion. So pterion, it's not pterion, okay? So P is silent, we call it pterion. Okay, what's the importance of pterion? So structure is present here.
Yeah, middle meningeal artery.
Middle meningeal artery, right? So the middle meningeal artery is very superficially located here. So if you have a trauma,